policy around extended school year services. We want to start by just recognizing that we know for parents and families, this has been 3 incredibly long months of schools being closed and trying to get some benefit out of the remote services. It's been very uneven. Some kids have been able to access services. We know many also haven't. A lot of the families we're talking to are increasingly exhausted and worried and facing the daunting months ahead. We know it can be very overwhelming. So hopefully this information we provide tonight will be useful. I wish I could tell you that schools are going to be totally open and your kids could be safely getting all the direct services that they require, but that is unfortunately not going to be the bottom line. There's a lot of ambiguity in what pace schools are going to slowly reopen some limited services over the summer. So we want to give you as much information as we can and give you a chance to ask questions. Joanne Pino from MAC and Julia Malecki from MAC are here. Julia will be, if you put your questions into the chat box on the bottom, Julia will be stopping during the presentation so that you can read the questions you ask. If we don't have time to get to all the questions, please feel free to contact our helpline, or if you need assistance trying to get the services you think your kids need. This will be recorded. We'll end at 8:45, but we will also stay on for another 15 minutes for if people have some additional questions that they want to ask. And one thing just to ask is if you have a question you want to send to me, don't send it to me privately because I can't read them while I'm talking and then they get lost after we exit. So you can send them to Lily and she'll be able to pass it on if you want. Lily, am I forgetting any logistics? Thanks for answering our poll.
It's everything.
Great. So, move this slide. So schools still have to provide extended school year services if they're in your child's IEP. A lot of this is going to be somewhat similar to what the ambiguity that you've all been wrestling with for the first 3 months. The extended school year services are going to look differently than they are when schools are fully open. They still have to be based on your child's IEP and your child's unique needs. And we know it's going to be frustrating to learn about what could and should be happening over time. We know it's very uneven in different districts. Obviously, this remains an unprecedented emergency. We've never had a pandemic. We've never had to slowly figure out how to open up schools safely. And so the bottom line is we know things are going to be opening up too slowly in terms of meeting the needs of your kids. And as always, the more that you know and can advocate and speak up for the school, the more likely, hopefully, your kids will start to get the services sooner. The slides are not going forward. They're stuck, Lilia. Oh, there we go. Sorry. So what is new right now? A lot of you have heard is that districts are being told by the state that they should be providing in-person services based on the IEPs to as many what they call high priority students as possible this summer. There's a polling question because we want to see if any of you have been notified already by your district that they're going to only be provided remote services and that they won't be looking at providing in-person services, because the state has been really clear with districts for many weeks that they have to be prepared to figure out probably a way to provide both. So here's kind of the summary of what the state has said is, and we're going to go into some more information about how districts are supposed to decide which students will be able to receive services this summer. First and foremost, schools have to follow very detailed health and safety requirements, and we're going to go over some of those briefly for you. And of course, as families, you want your kids to be safe as well, and you also want them to be getting the services that are so important. And the schools are going to have to prioritize the in-person services for the students with the greatest need, because they're not going to have the time and capacity to get fully open the way we hope they will be in the fall. That's generally, I'm going to go into more detail next. So it looks like about half of you have been told that school districts will only be providing remote services. So I know that the state has talked to special ed directors who have told them that, and I know the state has said to special ed directors they need to roll back those statements and really look at what's being provided as guidance, strong guidance by the state, and how to start rolling out services. So very briefly, these are the steps that the state has said that every school district has to do before they start providing in-person services over the summer. They have to identify which students they think they're going to be able to provide some at least limited services to and communicate with their parents, and we're going to spend a bunch of time talking about that. They have to hire their staff who are going to be working in person. Presumably staff have already been hired for remote instruction, but they may need to hire some additional staff. They have to purchase all the protective equipment that's necessary. They have to develop the full range of safety protocols that have been outlined in the state guidance about how to keep social distancing and masks, and we'll go over some of those in detail, washing, disinfectants. And they have to complete training of all the staff before they can start providing in-person services in the school district. So you can see it's a lot to do, and school districts are being encouraged to move forward as quickly as possible. And so a lot of families are asking, when will in-person services begin, even if they are for a more limited population of kids who are getting extended school year services. And the state has said that in-person services can begin on July 6th, but they know that many districts will not be able to start that soon because they have to finish those 5 steps. So they've been directed to start as soon as possible after they've completed all those safety steps. And the state's they understand that some protective equipment may be on back order, that it's going to take time to do the training. And so they've been very clear. If you can start July 6th, that's great. If you can expand your services over time, then that, after you've gotten more of the equipment that you need, and that's the way to do it. Even if you can't start until the end of July or August, they've made it really clear that they expect districts to figure out how to start providing some in-person services. And I think what the state recognizes is for some students, so we see, would you want your child to receive in-person services at school? Majority say yes, some say no, and I know a lot of families are concerned about health concerns that their child might have or safety concerns, and some are not sure. Okay. Sorry, this is my first time to advance my own slides and they don't work. There we go, consistently. I skipped a slide though. Sorry. I think I'm not going to advance my slides anymore. Seem to be missing a slide. All right, so the bottom line is going to be that because of how they prioritize services, almost all students are probably going to receive some remote learning, and there are going to be some students who are going to receive in-person services as well as remote learning. So here's kind of probably what a lot of you are eager to find out is how are districts being told to identify the high priority or high need students who should first be receiving the in-person services as they can be rolled out. They're supposed to look at 3 criteria: the students with the most significant disabilities, the students who have experienced substantial regression with remote learning, those students who need a broad array of summer services, instruction, as well as various related services, and those students who have been identified as needing more time to learn the COVID-19 safety procedures that are going to be required for fall reopening. We know that there's some districts who are already saying we're not going to do this at all. We know that there's a lot of concern about how the districts are going to determine which students should receive the limited capacity they have to provide in-person services. I think the state and districts recognize that even with all their best efforts, at least the way remote instruction is being provided to date, it's not effectively meeting the needs of students with more significant disabilities. Distance learning is not effective as in-person services for all students, disabled and non-disabled, but we know there are some students who really are facing huge barriers accessing what is being provided remotely. The bottom line is school districts still have to figure out how to provide a free and appropriate public education. It still has to be based on your child's needs and the IEP. And it is, I think, going to be very bumpy and uneven district to district how these in-person services are provided. Should we keep going or do questions?
Yeah, can we pause here? We're getting a lot of questions in. So we had a few questions about how high priority is defined, which I think you covered, but somebody asked, is high priority an objective measurement or comparing to others in the district? It looks comparative.
It's a really good question, and I think a lot of advocates and parents are really struggling with this. It's supposed to be, I think, objective, the way they lay it out in their guidance. On the other hand, if you have a limited capacity, it's going to, in some cases, I personally don't know how it can be somewhat comparative. But the goal is that the district's capacity to provide in-person services will hopefully grow over time. So, I mean, I think the guidance assumes that districts will be the ones determining which students fall into this category, but and we'll talk about this later, but our advice is you as the families are the one who have been seeing your kids for 3 months. You know directly the degree of regression, if there has been regression. You have a very good sense about what's going to be needed for your child to learn how to comply with safety procedures that we'll go over in the fall. So, like, it's not that you have more time and need more things to be communicating with the district about, but we think it's very appropriate if you believe that your child needs these services and meets these definitions and requires these services to meet their needs to notify the school district. And we'll go through that in some more detail.
Okay. Our next question is, will they keep the extended school year end date the same now if they're starting a week late?
It's all based on your IEP. So hopefully your IEP is specific about the extended school year services that your child is entitled to, how many weeks, how many hours, how many days. Now, again, we know in this period of pandemic that your child is IEP, this is like alphabet soup, the IEP, ESY, the IEP, extended school year services are going to be provided differently. There'll be a combination of remote and just like these last 3 months, which is why your children may have a need to get some compensatory services when schools do more fully reopen. I forgot the question in the middle, doggy.
The question was, will they keep the extended school year end date the same now?
It should be the number of weeks that are needed to implement your child's IEP. And if school year let's say you have 6 weeks of extended school years, 6 weeks of summer services in your IEP, and they start late, so you only get 5 weeks, then I would say arguably then you have a right to compensatory services for that last week, that they didn't provide what was in the IEP. Does that make sense? It's very hard when I don't see faces, but.
Okay. And then someone asked, can the in-person be one-to-one at home or the library, or are they only doing that in school buildings?
Let's go on to the next slide because we're going to talk about that.
Okay.
I can effectively move it. So first I'm going to talk about what services the state is saying should be provided in person. It should be including individual instruction, small group instruction, as well as the range of therapies that the kids require. The same requirements, the state simultaneously issued guidance around summer's remedial programs for gen ed as well. There's very analogous guidelines and encouragement for school districts to start providing those summer programs as well. For all kids, the length of day is limited to 3 to 4 hours a day. So again, that's why if your child had a summer placement that was 5 hours a day or 6 hours a day, then there should probably be some combination of remote and direct instruction. If they do end up getting some direct services, there's no field trips allowed, and the state is hoping to issue some more guidance tomorrow. They're looking into whether or not community-based transition services could be provided if they're being done safely. There's not an answer on that one yet as well. There are also assessments could be provided in person as well, as long as they meet the assessment, the safety requirements. A little bit in terms of how the in-person services are provided, and I am going to get to the where that question was. Students and teachers must wear masks. We're going to talk about home in-person. Can you wait for that question a minute, Lilia? Well, anyway, it doesn't matter. Students and teachers have to wear masks unless the students are unable to, and we know a lot of the students with the most significant disabilities may be unable to tolerate masks or wear masks, or obviously they have to make those accommodations. There can be no more than 10 students in a group or 12 people total. They are requiring the social distancing of keeping kids and individuals 6 feet apart. However, they also do acknowledge that a lot of students, especially in these groups that get ESY services, are going to need hands-on assistance, you know, where they're not going to be 6 feet apart. And there's very specific requirements about the protective equipment that staff should be wearing if they're providing hands-on assistance, you know, whether it's toileting or hand-over-hand instruction, other services. There's very explicit instructions about how the staff should be wearing protective clothing to be safe. Let's look at my notes. There's also guidance around, you know, how to position different groups of kids or individual kids so that they're socially distanced from each other in the building. There is not a requirement to do temperature checks. That's one thing that I think people expected, you know, basically because what the evidence from the CDC shows, according to the state, is that temperature checks are not a useful way to determine who is potentially have COVID or not. Trying to move the slide, sorry. So services cannot be, other than what they're thinking about for transition services, the in-person services have to be provided either in the school district or, consistent with safety requirements, they can be provided in the family's home. Not moving forward. So, and the state's very clear, because we've heard from a lot of families who are very worried about the health and safety of in-school services because they may have their kids may have medical fragility, they may have pre-existing conditions. So parents, for the summer, we don't know what the fall guidance will be, can choose to continue remote learning at home, or the district is encouraged to offer the in-person services at home as long as they address the safety requirements that are there. So basically there's 2 ways that a child could get home services now. One, some of you have home services in your child's IEP. So the state is saying it is okay to provide those in-person home services in the same way that insurance covered ABA providers have been providing home services throughout the past 3 months. So the school districts would have to do it in a way that's safe. But even if your child's IEP doesn't have home services in the service delivery grid, that can be another way to provide your child's summer services differently. And the state acknowledged that in some ways that may be easier to deal with a lot of the, you know, the travel and other logistics that end up dealing with more potential communication of COVID. But safety is always the number one and first concern about providing any in-person services. So people may have a lot of questions about transportation. You can ask a lot of questions that I don't know the answer to because they're still, you know, this hasn't been rolled out yet. But what the state has said is, if possible, parents are, if they choose to, are being asked to provide the transportation and then be reimbursed by the school district. Mostly because, you know, as the Department of Public Health has said, it reduces the amount of contact. But if parents are unable to, we know not all parents have cars, we know some parents are working, then the districts, according to the state, do have to provide transportation. And the transportation requirements are also very specific in terms of the cleanliness, the disinfectant, the social distancing, you know, placing students one in a, if it's a bus or a van, you know, having distance in between. the protective gear that's required. And the state has said that the district has to communicate directly with the families about, so you have information about how frequently the van or the bus is cleaned and disinfected, and what are the strategies for getting the child on and off that are going to be addressing safety and health concerns. They're supposed to be notifying you of that information. Now, again, school districts are, ordering protective equipment, some of which is on back order. They have to start arranging transportation with their vendors, which may take some time. So this must becomes a little bit less than a must if they're not able to arrange it in a timely fashion. But again, that's where I think the kind of advocacy and creativity can hopefully work out solutions. If they are providing the services shouldn't be limited to those families who are able to transport on their own. The other thing that the state has emphasized, the way they've been trying to emphasize each step of the way from March until June, it's hard to believe we're in June, is that the collaboration and the communication with families is really foundational and pivotal. And they have to be notifying each one of you, not a group letter that says we're all going to be doing remote instruction, but that's similar to the remote learning plan, but they have to notify you how your child is going to have their ESY services implemented over the summer. They don't have to do a new remote learning plan. They can notify you in any way they want, but they have to tell you what the schedule's going to be, what will be in person, if any, what remote services will be provided, the name of the educators, the schedule, the start date. And again, it's a lot for school districts to roll out in a relatively short period of time. So it may not start within the remote services, you would think could start on time, but the in-person services may not, with all that they have to do. Remember those 5 things, may not roll out on July 6th.
Julia, we've got a lot of questions coming in.
All right.
Is this a good time for a break?
Yes, but I did want to say one thing about this and then go for the break is, I know that for a lot of kids, their extended school year services might be a smaller amount or frequency or duration of services that are provided during the year. And we have heard from some families that are saying that they're already getting a revised remote learning plan that's reducing the services that were being provided during the regular school year, which does not make sense educationally or legally, right? If the services being provided over these last 3 months were already less than what's required in the IEP, as a lawyer, I can't say I can't ever, but I can't see a reason why they should be providing less remote services over the summer. And if that's the case, you can certainly call our helpline or call others to figure out how to move forward on that. Go for it, Lilia.
Okay. Our first question is, the regular school day was only 50% when they were remote since March. Is DESY giving similar guidance for extended school year? I feel like ESY is already reduced, and to reduce it further at the DESY guidance seems wrong.
The DESY guidance around special ed has always been that the IEPs still need to be implemented. So there was never any DESY guidance that I'm aware of around special ed that said only part of the IEP and only half of the day the IEP needed to be implemented. I know that that's how some school districts interpreted it, but I do not believe that that's legal or consistent with the state guidance. In terms of the in-person services, those are limited to 3 or 4 hours a day. But there is not a limit in terms of the amount of remote instruction services that a child might be able to receive. However, that's the PS of all this. School districts only have to do what they're able to do safely, right? And so that's why it's going to be so important for them to hear your voice about and we know that they're not going to be able to implement 100% of the service delivery grid for your kids, which is why it becomes so important to be documenting what you can. And we have a new way to hopefully make it easier for you to document things going forward. But the same mantra, do whatever you can to get as many services as you can now for your kids so that they have less of a need for compensatory services later. I mean, it's in your kids' interest, obviously, and it's also in the school district's interest to do as much as they can.
All right, thank you. This question, we've gotten a lot of similar questions to this in our past chats as well. If our child is turning 22 while all of this is going on and has extended school year, how do we go about getting makeup services? And before you answer that, Julia, I'm just gonna relaunch the poll that we started before.
Thank you.
So people could answer that. Okay.
The state is well aware that that's a really big issue. The compensatory services for kids of all ages are going to be a very big issue, and the state is planning to put out guidance sometime in July around what the process should be for determining what kinds of compensatory services individual kids might be entitled to. However, there's been a lot of advocacy on how to address the needs of kids who are turning 22 between the middle of March and the end of August. Let's hope schools open, at the time that they should, the school year, and trying to find some solution for those kids. It's very clear for every one of those kids that there has to be a process and an individual determination made to figure out whether or not they're entitled to compensatory services for the services that they've missed. That could include, like this question said, the summer services. And if a child is entitled to compensatory services, the law is clear that those services can be provided after the child turns 22. At the same time, it's going to be a very cumbersome process, kid by kid. So mass advocates, as well as many of the other advocacy and parent organizations, are advocating for some kind of policy to make it easier for those families and those students who are in very vulnerable positions right now, transitioning or not being able to transition effectively to adult human service agencies. So I'm hoping the next few weeks we'll have further guidance about that, and hopefully there will be solutions beyond the ones for individual kids. But for your individual kids now, I think you can start advocating for the compensatory services that your kids need, and also how to make a smooth transition.
Okay. As a follow-up to that, should the district be trying to get students into job sites for vocational training if that's in the IEP?
As the state has said that hopefully by this Friday, they're going to give more clear guidance about that, about whether or not community-based transition services can be provided safely. I think they wanted to go back and check with the Department of Public Health and some others. I think there's could be arguments that if businesses are open now, and if grocery stores are open now, and there's conditions around how to do that safely, then perhaps it is possible to start providing those kinds of services in a manner that meets all the safety requirements. Whether or not we're going to have a clear answer by Friday or not, I don't know. We can let people know in our next chat. But it's a question mark. But again, if it's something you feel that your child needs, since everything's going top down and bottom up at the same time, I think it's completely appropriate to raise it with the school district, and hope, even if they can't offer it now, maybe they'll be able to offer it later on in the summer if it's in your child's IEP for summer services.
Okay. And we've gotten a few questions along these lines. What should I do if my district will not provide any in-person therapy or services, but I think it's needed?
We're going to get to that in very soon. So should we keep going? I love how people give the introduction to help us move along. As long as I can figure out how to move slides. So we were just talking about how important it is, and this gets to what you can do as well, that your voice about what your child's needs are and how to meet their needs is absolutely should be critical in making these decisions. The state has made it clear that districts should not be just notifying families, but they should be having a dialogue with families to make these decisions. So, that's where your voice and how you perceive your child's needs, having lived them day and night for 3 months, becomes so important. And again, just to emphasize, these are such important safety and essential services we're talking about, and the law is very clear that all the districts have to be communicating, writing and verbally, in parents' primary language to make the communication be effective. So the question is, what can you do now? So if you want to consider in-person services, then our advice is contact the district. You know, our advice is always to do things. It's fine to do something on the phone, but it's good to have an electronic paper trail. You know, you can do it in an email or do it in a text that you save, and explain why, in your view, and you have a lot more day and night knowledge about your child than the district does, at least over these last 3 months, why your child is high priority, high needs. Every kid is a priority. Every kid is a priority. I mean, these are really difficult decisions for administrators and teachers as well, but most difficult for the kids. So tell the district about, if your child's IEP, their need for these multiple types of services, the regression, if you've observed regression, and about your child if they're going to have to be adjusting to a new kind of schedule. If schools are going to have students be in 1 week and off a week, or in half a day and other kids coming, whatever they're going to be doing in the fall to deal with the social distancing requirements, things are going to be very different. And so you have a sense of, some kids have a hard time with transitions and changes. So you can talk about whether you think your child's going to need more time to learn how to deal with all these safety requirements. Ask any questions you have about health and safety, to make sure that you're, I'm trying to move things so I can see these slides because all this stuff is all over it. And like we said, consider home services. So if it's going to be frustrating, it's going to be very frustrating as you weigh the pros and cons for your own kids. And like it has been the last 3 months, when your child could benefit from something and the district isn't able to do what's required. So if you believe your child needs in-person services and the district has said a blanket no, then there may be some particular advocacy that you can do, right? If they're saying we can't do it yet because we haven't trained all our staff, we still have to get the equipment that's needed, we're still cleaning the buildings, and the same thing goes with the home services, right? They're still going to need to address a lot of the safety concerns, and they still are going to have to make sure they have all the equipment that's needed. So I think for the families that we work with and help advocate, it really depends on how the district is responding. And they are supposed to be making a good faith effort to start to provide these services. So the blanket policies of how they're not going to do any kind of in-person for anybody, for us, seem very problematic. But that doesn't mean that all the kids who need in-person school or home services are going to get them, which is really what's so heartbreaking about all this. More questions, or keep going, or I think we're almost done. Should I just go to the next slide?
Sure, yeah.
Yeah, and then our strong advice, and this is similar to what you've heard in the last 3 months, document how your child is doing with what the school is offering currently, without the in-person services. And the link here on the slide that Lilia will be sending out hopefully tomorrow, or maybe you can also download this. There's a new log application that Mass Advocates is just releasing. We developed this with Mass Families Organizing for Change. So this is an app that you can use on your phone or on the computer to make it more easy to keep track of what instruction or therapies are being offered by the school day to day and how your child is doing. And the more you document how your child is doing, the more you have the data you need to show the district why, if you believe they should be getting in-person services, why it's so essential that they are a high priority child that needs to be getting the services that they need. And this documentation will also be helpful in terms of addressing additional services they need and compensatory services when the school's open. So we're really excited about this app. It's currently in English and Spanish. It is being translated into other languages. And Lilia, are you downloading that as we speak? Or?
Yeah, I'll throw the link in the chat box.
And so that kind of documentation, or even we've said before, video, videos with your phone of some of the difficulties your child is having with only remote instruction, may help the district to realize how your child really needs to get in-person services as soon as they can meet all the safety requirements. And then depending on the time urgency, if there's time to first email the principal or the team leader with, what we said before about why these services are so important to meet your child's most basic needs and your major concerns. You can also file complaints, and the links are here, with the State Department of Ed or request mediation. And you can contact Max Helpline. Our hope is, as our hope has been every step of the way, is that the more vocal families are, and as they listen to the state about needing to collaborate with families, they'll figure out solutions for kids who are some of the most high need kids in the state and in the district. But we know it's going to be very uneven, and there's some kids who are still going to go too many weeks without the services they need. I think we've talked about compensatory services. They will be, we talked about this already, and about the two. We're hoping for some guidance about kids turning 22 sooner, young adults. And we also know that while you're facing all this for the summer, it's not that far away when schools are going to be opening for the fall. So two things I need to say. I forgot to say this at the beginning. The state issued this guidance on Sunday night. They're going to be issuing more detailed guidance in the near future. So it's not going to be changing unless things medically change in COVID. I mean, everything's always subject to how COVID numbers are going, right? But there will be more further guidance about how to implement these steps for the summer. This gets really confusing. And then mid-June, which is kind of around the corner, we don't know the exact date, they're going to be announcing their guidance for the fall reopening. So things may be very similar to what we're seeing in the summer. There may be some different guidance for the fall. So as you start to think about the fall reopening, which will presumably be more in-person services than are currently being provided over the summer, it will remain important for you to think about what accommodations and other needs your child's, other ways to meet your child's needs in the way education is going to be provided in the fall, because it is still going to be different from the way we're used to. I think that's the last slide. Yes, and then resources here and links. So more questions.
All right, great, thank you. We do have a ton of questions. If we're not able to get to your question tonight, I put the helpline information in the chat box. And we will be sending around a recording and the slides and resources in an email tomorrow or Monday. So our first question is, are things different for English language learners? Was there any requirement for teachers to communicate with ELL kids who have had no outreach from the teacher or the team? I have a student, my daughter has been tutoring, who had no calls from the district after 2.5 months of the kid
That
not
is
signing on.
a huge concern, and clearly not legal or consistent with state guidance. Our office has been doing a lot of advocacy around the lack of access for kids who are English learners, or for kids who may be fluent in English and Spanish, but their parents are non-English speaking, or whose primary language is not English, and so they can't help their kids because things aren't being translated and interpreted. So the state's been very clear that there should be, for all kids, but especially for kids with disabilities, for kids who are English learners, and for kids of color and for kids who are low income, who may be facing a greater impact of COVID. As we know, that COVID has been disproportionately impacting kids, families of color, Black and Latino families. So for families who are facing more barriers over these 3 months, the state has said the school district needs to be providing regular contact with the families, and it has to be in the family's primary language, and they need to figure out what things need to be interpreted and translated so families can effectively support their kids. So that is, again, I would encourage you, whoever, to have yourself or the family call our helpline. There are some remedies. The state is actually rolling out some interpreter and translation services that districts can use, and they're piloting it in 5 districts now because they recognize the urgency of that problem. I've been told to answer questions more briefly, so Lily, I'm moving along so I can do that.
Okay.
You don't see people's faces to know at what point they seem to have any, if I make sense.
All right. If I believe my son should be considered a priority special ed student for extended school year in-person schooling and his designated program, the out-of-district school that he attends, indicates that they will not be offering an in-person program this summer, what recourse do I have with the school district special ed department to offer an alternative in-person extended school year program?
I don't know. I mean, I don't know what the person's actually, if the question is asking the school, the guidance has talked about in person in the school district and in the home. If the questioner is saying, I'm aware of some private service provider who can meet all the safety requirements of the state, so could I argue that the school district has to provide those in-person services? I think it's arguable that you could make that claim, but you'd have to show that they can meet all these same safety requirements. But that might be a possibility, but I'm kind of guessing what the question is. That person could follow up with you to see if I'm on target.
Okay, yeah. If you have additional information, or contact our helpline and they can talk to you about that.
So the number one, I guess the state is saying two things. IEPs for ESY have to be implemented. But first, you have to address these, very detailed, that are going to be even more detailed safety and health and safety requirements. So if the in-person services can't be provided from the school district and or at home, and if there is a way to provide those services safely otherwise, I don't think it's in the state guidance, but I do think that there could be an argument legally that they should still be providing those services. But that doesn't mean just because I, as a lawyer, think that that's where it would fall. But I think this always requires creativity and collaboration, and we're hoping that's what school districts will do.
Okay. Next question is, does early intervention fall under the same guidelines regarding in-person services?
Early intervention providers have always been considered essential service providers. So yes, they have to abide by the guidelines that have been in place already for essential service providers, and they are, I know that the programs are now figuring out when they're going to start providing in person in the EI centers and in the homes. But they so it's similar but different because they're considered essential service providers all along.
Okay. You mentioned at one point a remedial program for special ed. Is that the same as ESY? Is the goal to maintain previously learned skills as of March, or to catch them up to where they should have been in June?
I'm sorry if that was confusing. I was talking about there's extended school year services for kids with disabilities, and then many school districts also have summer school programs for the general ed population, many of which are remedial for kids who need extra instruction over the summer. So I was talking about the fact that it's not only disabled kids with disabilities who will be hopefully in the school buildings gradually over time. The state's encouraging both sets of programs to be open over the summer. Does that answer the question?
Not hearing objections. Yes. Okay. Thank you. I'm going to go ahead and launch another poll in a second, but first, someone's asking, if our school doesn't offer in-person services, would it be reasonable to seek services at another school?
I think that it's reasonable for parents to be as creative as they can and see if they can work out something with a school district. I don't know if they mean another public school or a private school. The private schools are having to figure this out. If your students in and out of districts, whether it's a collaborative or a private school, they're figuring all this out as well. But I think it's, if there's ways to get the services your child needs safely, I think it's completely reasonable to approach the school district about that if they're not able to provide those services. Doesn't mean that you'll work it out, but I think it's a smart way to think about it, because the idea is to work collaboratively, parents and school district together, to figure out how to safely implement the IEP. That's the school district obligation. That's obviously your goal as a family member, and I personally think it's a creative way to think about it.
Okay. Our next question is, I haven't received any services for PT, OT, or speech. How do we push for these remotely? Should they have been receiving them in the last 3 months?
Yes, and it's 8:45, so at the same time, we're gonna post our evaluation survey. Is your child able to effectively access remote instruction? Wow, 70% still no. That's depressing after 3 months, but not surprising from what we hear from families. Ask me the question again, Lilia. I just lost it when I was reading the poll.
Okay. I haven't received any services for PT, OT, or speech. How do we push for those remotely, and should they have been receiving them in the last 3 months?
If those related services are in your child's IEP, then yes, the school district is supposed to be, they may not be providing the same amount of frequency for your child, but they absolutely are supposed to be providing those services for your child in a manner that's safe and consistent, with all the remote requirements. We are aware that there are some school districts who still have policies that they are not going to do that. And that's the kind of issue where if you can't work it out with the school district, it may be very appropriate to file a complaint with the state, because they're making a decision that's not based on your child's needs. It seems like they have some policy that they're just not providing those services. Or even if they are providing it for some kids and you feel like your child does need them, that's still very appropriate to first contact the school district and see if you can work it out. And if not, it's appropriate absolutely to do more advocacy and potentially to file a complaint.
Okay. We also got some feedback that people wanted a sometimes option on that poll. So it sounds like it's maybe not consistent.
So I'm gonna, for the people who, we know that we're trying to keep this to 45 minutes because we know you're all so busy and I assume increasingly exhausted. So thank you so much for joining us. I wish there was more, it's hopeful. Things are beginning to open up, but it's always so slow when you can see your child, how they're struggling, and in so many cases just falling further and further behind. And there's nothing more painful than watching your kids struggle. So I wish things were moving more quickly. I hope that we see more progress over the coming months. I will stay on till 9 to answer more questions for those who want to stay longer. I know somebody had emailed some questions about early intervention, and Lily, are you able to drop those documents into the comment section that I emailed you?
Yes.
Early intervention is now making services available through early intervention for kids who turn 3 between March 15th and August 31st. So we're going to pop some information into the comment box about that.
Or actually, I don't have them available now, but those will be in the email that everyone gets either tomorrow or Monday. Okay,
I emailed them to you if you can find them while we're talking. But any other questions?
Our next question. If you decline in person due to complex medical risks, are you alleviating the district from compensatory services?
No.
Okay. It's rare to get a straight answer like that.
You still have, if for families who decline in-person services, the school district should be thinking about whether, in-person home services might be safe, but they still may not be safe for kids in certain situations, or for family members for that matter. So the school district still needs to offer remote instruction. And to the extent that the remote instruction is not fully implementing the child's IEP, then there could still very likely be a right to compensatory services. I didn't give you just one no, sorry. No lawyer is capable of doing that.
Someone had asked, will DESY provide any stronger language than just guidelines? School districts seem to interpret guidelines loosely and results in parents assuming the burden of making sure their child gets the program and services in their IEP.
That's a really good question. These are guidance. They're not statute. They're not law. But what is law and has not changed, and the federal government has made it clear they're not going to change it, is that even during the pandemic, your child has a right to have their IEP implemented. And that hasn't changed. And so that's actually the strongest part of the law is still in place. It is unbelievably frustrating. I mean, even before COVID, right? I would imagine if we did another poll, most of, we have these beautiful laws on the book, schools are fully open, and it is still on the backs of parents. Like every other civil rights law, the laws aren't self-executing. So you as parents have to become not just parents and teachers and, know all the skills of the different service providers, but you have to become knowledgeable about the law and policy. But those responsibilities, you're right, are 1,000 times stronger in this period of unknown, where it requires even a stronger voice to make what seems impossible possible. So I think that there may be some pieces that come out more strong, hopefully, over time. But I think the main thing I want to underscore is that the statutory right to have your IEP, child's IEP services implemented in a way that's safe is very strong. And the state is now saying there are ways to begin to safely provide the services. So I wish it was better news, but that's kind of where we are now.
Our next question is, when would be an appropriate time to talk compensatory services? My son's teacher provided remote learning since March, but he did not receive his speech, OT, or PT direct services. For extended school year, we've gotten his teacher, but speech, OT, and PT services haven't been addressed. Should I contact administration to ask about those direct services? When is an appropriate time to talk compensatory services?
I think there's no inappropriate time to start contacting the school district about those services, but I think the districts are going to, the state is hoping to issue guidance to districts about how it's going to be a massive number of kids where they're going to have to be figuring out how and what kind of compensatory services to provide for kids. So I think it's a good time. I mean, it's going to be fall before we know it. So I think it's a good time to start collecting the information, use the app to see if, because you'll want to know not just what services weren't provided, but how your kid is doing. How well has your kid been able to access the instruction that's being provided? Has there been an impact on their ability to learn by not getting the related services? All those things are going to go into the equation about what compensatory services your kids might be entitled to. So I think it's smart to think about preparing that for the school district. You could certainly send it to them now, although there still may, if your child's entitled to summer services, then you still may have more claims to compensatory services. I don't think they're going to start processing them now, so I don't see a particular rush. I think they're going to wait until the state guidance, but I see no reason not to start pulling that together now.
Our next question is, are schools allowed to say no to in-person services without showing evidence of attempting to follow the guidelines? How do we know the districts are trying their best to provide services?
Again, this is just one lawyer speaking, but I think what the federal government has said from the beginning is that the right to have free and appropriate public education and IEPs implemented is still in place, with the caveat that services have to be provided with safety and health consideration first and foremost. So the state has now said you can provide in-person services if you meet those criteria. So that's why if I were a school system lawyer, I'd be very worried about these blanket statements that we're just not going to do it without trying, because to me, that seems like pretty clear non-compliance. It's a different question is, how do you know whether or not the school districts are making good faith efforts to meet those 5 criteria? I think a lot of you are probably very active in your community. You'll be knowing what the school district is doing. I think the school districts that we work with, even though we end up, sometimes having to litigate and advocate, they are committed to kids. The teachers are so worried about the kids who they know are having huge difficulty at home without services. I think districts are nervous about safety in the same way parents are. They don't want to go back. Teachers don't want to go back to schools until they know it's safe. But everybody wants to make sure things are safe. So I think it's smart to be vigilant and make sure the school districts are moving forward quickly. But I do believe that everybody is on the same page about wanting to get kids into school as soon as possible. And people are all nervous about how to do it safely. You know, we've never done this before. So it's makes people scared, rightfully so.
Absolutely. If our child is out of district, who is responsible for services? The school district or the school, which is in Connecticut?
If the child is in an out-of-district placement, then that school should be providing the services. If they're in a different state, it might get a little bit more complicated in terms of what that state is requiring the out-of-district schools to do. So it's probably a little bit more complicated in terms of a contractual issue, but it is out-of-district placements are still being paid for by school districts, and those day schools and residential schools should still be providing the services.
Next question. My school is saying federal laws will not let them do virtual speech. I'm getting coloring sheets, I guess, instead of the virtual speech therapy. Is that okay?
I have never heard that one. I've heard a lot. But I don't know of any federal laws. I mean, Medicaid, which is a federal law, immediately covered remote teletherapy. So that one I haven't heard before, but please call our helpline. Those are the kinds of things where we feel like we can provide some more immediate guidance and help.
Okay. Similar question to the one I asked before. If a child was in a private placement out of district, but has now transitioned into public school, always with an IEP, who does the compensatory services?
That's a really interesting question. I would assume, again, this is just my opinion, is that if they were for part of the emergency shutdown of schools in the private school, well, it's ultimately the home district is the one who's ultimately responsible for making sure your child's IEP is implemented. So the buck stops with the home school district. But for the amount of time the child was in an out-of-district placement, the school district could arguably say that they're potentially obligated to provide some of them, but that would be a contractual issue between the private and the out-of-district school and the home school. The ultimate responsibility is your home school district. So again, I don't know the details, but my off the cuff, and I might think about it differently in the morning, is that it should be the home school district, and it's between the home school district and out of district to figure out how they should be cost sharing it.
Okay. We have time for just a couple more questions. IDEA doesn't preclude offering both in-person and remote instruction. Is that correct?
Oh, I'm so sorry if I didn't make that clear for all the people who left. It's not, that's why it's assumed that almost all kids are still going to get remote instruction, because it's going to be, it can't even be a full day. So it's going to be, I think I did mention that, it's probably, even for the kids who are getting direct services, they're probably going to be limited, and it's assumed it will be remote and in person. And I hate to say this, but at least for some kids, everything could change by September, but it's assumed that it may well continue to be a combination for all kids of in-person and remote. Not that any parent wants to hear this right now.
And our last question. My child's eligibility meeting is next week. Since the school year is almost over, how much time do I have to sign off on their proposal? I'm expecting I won't be 100% on board with it. Do they have to continue to work on this with me even once school is out?
That is a really interesting question. The time, I mean, if it were me, without knowing any more details, I would advise you there's a way, if they find your child eligible, but you're not pleased with everything, the best thing to do might be to accept in part and reject in part, because generally the timelines don't go over the summer, but you can also continue to negotiate and work with school districts over the summer, and there's certainly a good reason that the state is encouraging school districts to keep the IEP process going over the summer, to keep evaluations going over the summer, so there's a good chance you could keep working things out. But I guess my gut is to try to get as far as you can, even if it's having to reject in part before the school year.
And that's a wrap. Thank you, Julia. I'm just dropping a couple resources in the chat box. If anyone has ideas for future topics for chats, please send those to us in the chat box as well. Julia, any closing thoughts?
No, just thank you all so much. These are great questions. I wish there were better answers. We so appreciate your willingness to hang in there, advocate for your own kids. I know that a lot of you are helping other families as well. This is just, it's beyond words what a difficult and exasperating time this is. And we appreciate your passion, your commitment, and your willingness to help work with school districts to figure out how to get services to kids as soon as possible. So have a good rest of your evening. And most likely we're gonna have a psychologist next week talking about how to do remote evaluations, but that's not confirmed yet. And thanks so much for being here.
Oh, someone mentioned our website resources. I'll put the link to that as well.
Try out the new app.
Mm-hmm.
We're very excited about that. You dropped that in a few times.
I did put that in there. It is, I had it. It's log.education is the, and I'll put that in the chat box too, but that's the link for it.
Somebody's in the waiting room.
Yeah, I know. Well, yeah, no, they're gone.
How do I unshare my screen?
At-
Should have done that a while
Got
back.
it. Okay.